Hello, my name is Reza Mohammadi. Today I'm going to talk about hepatitis A, B, and C. I'm going to talk about the definition and types of hepatitis as general term, and specifically on viral hepatitis A, B, and C, and the virology and etiology of the disease, and also talking about epidemiology, prevalence, and incidence of different kind of hepatitis, pathogenesis and pathology of hepatitis, and also clinical term and a laboratory test of hepatitis. And a little bit talk about treatment and also vaccine of hepatitis. What is hepatitis? Hepatitis is inflammation of the liver and depends on the duration and the inflammation of the liver and also the liver damage. We have two types of acute and chronic hepatitis. Acute hepatitis takes less than 6 months, and chronic hepatitis takes more than 6 months. Liver inflammation can be caused by drugs, different kind of drugs. One of the most common of those is acetaminophen, Tylenol. Also, it can be caused by alcohol. The person should be heavy alcohol to get hepatitis. Toxin, in particular aflatoxin, and also autoimmune disease, in particular primary biliary cirrhosis. Genetic disorder like Wilson disease, the impairment of metabolism copper, and also we talk about the most common cause of hepatitis, viral hepatitis. Viral hepatitis is a systemic infection that mainly affects the liver. We have five types of viral hepatitis: type A or hepatitis A virus, hepatitis B virus, C, D, and E. Viral hepatitis can cause both type of hepatitis, acute and chronic. So we have acute hepatitis A, acute hepatitis B, acute hepatitis C, D, E. Also, we have chronic hepatitis B, chronic hepatitis D, and C. It means we do not have chronicity for hepatitis A and E, and hepatitis A and E do not cause chronic hepatitis. Serologic and virologic markers of hepatitis A. Hepatitis A virus can be detected in feces after 1 week of getting infection, but this is not a routine test for diagnosis of hepatitis A. Actually, a better test is IgM anti-HAV, can be detected for 3 months of a first-time infection. And also, IgG anti-HAV can be detected permanently after acute phase of the disease. It means hepatitis A create permanent immunity after one-time infection. As we see in this graph, after getting infection, we have viremia, and after 1 week, we can detect HAV in the feces. And after 3 or 4 weeks, we can see clinical symptoms in the patient. As we see in brown dashed line shows IgM can be detected between 2 or 3 weeks up to 3 months. After 3 months, we cannot detect this antibody, but we can detect IgG anti-HAV. That means actually former infection. But in acute phase of hepatitis A, we can just detect IgM anti-HAV. We have Dr. Bo Blomberg, who discovered hepatitis B in 1967. And after 2 years of that, he discovered hepatitis B vaccine. This vaccine was the first anti-cancer vaccine at that time, actually. We have now HPV vaccine that it is anti-cancer, but at that time, that was the first anti-cancer vaccine. Hepatitis B virus belongs to hepatinoviruses family, a very unordained particle of the virus surrounded by icosahedral protein capsid. The virus can be replicated by reverse transcriptase. As we know, hepatitis B can be transmitted by parenteral, sexual, and also mother to child or vertical transmission. The virus has three different antigens that are very important. First is core antigen or HBC antigen. Actually, it's a nucleocapsid of the virus or C antigen. And the other one is the surface antigen or HBS antigen that is very important. And this antigen shows actually the acute phase or active hepatitis. And also E antigen or HBE antigen is sort of a free particle in the virus. Uh, these three markers are very important for diagnosis of different kind of hepatitis, acute or chronic or active chronic or asymptomatic. We can talk about it later. First virologic marker can be detected in serum is HBs antigen. That is very important. The second marker is anti-HBs antibody. It becomes detectable after HBs antigen disappear and remain up forever. HBC antigen is not detectable because it's surrounded by envelope, but we can detect IgM anti-HBC in 1 week of infection, and it's going to be up till 6 months. As we see, there is a gap or window in here between disappearing HBs antigen and when we cannot detect anti-HBs antibody. So in this gap or window, the best marker is IgM anti-HBC. Also, we have IgG anti-HBC. That is the only serologic test that represent current infection. As we know, IgG always represent past infection, but here we see in current infection. HBe antigen is an active indicator of viral replication. So HBC antigen shows the pathogenicity of the disease. It means the disease is so infective. And also HBe antigen positive indicate the patient is able to transmit the disease. Anti-HBe antibody indicate inactivity of the virus and the patient is not spreading out the virus. As we see in this graph, the first marker is going up is HBs antigen, starting from 2 weeks, and the peak is 2 to 3 months, and then coming down the brown line, and after 6 months it's going to be disappeared. But anti-HBs antigen is going up the black line, and between the brown line and black line there is a window, and in this window the best marker we can detect is anti-HBC antigen. As we see in here, we have HBe antigen between 1 to 3 months of the disease. It means the patient is so infectious. And after HBe antigen coming down, anti-HBe is going up, and it means the patient is not more infectious. Virology of hepatitis B. It was known as non-A non-B hepatitis. It's a Flavivirida family, Hepatovirus genus, and it's a single-strand RNA virus. As we see in the picture, uh, there is three structural core protein C, and also envelope glycoprotein E1 and E2 that's surrounded in lipid envelope. The virus is very high mutation rate, as we see later, the treatment of disease is depending on the genotype of the virus. And transmission of hepatitis C is like hepatitis B, parenteral, sexual, and mother to child. The marker of hepatitis C virus is detecting HCV RNA by PCR or by sequencing of RNA. If it's positive, it indicates acute infection. But also we have antibody against this HCV, and if it's positive, we should see if at the same time we have RNA, it shows acute hepatitis. But if we do not have RNA, we cannot detect RNA, is chronic hepatitis. Here is comparing hepatitis viruses, and as we see, hepatitis A virus is the smallest one, and hepatitis C virus is the largest one. And also we see here in the classification of the three viruses, and also transmission that HIV is fecal oral. We already talked about it, and HBV and HCV, both of them are parenteral and sex and mother to child. Epidemiology of hepatitis A. Viral hepatitis results in around 1.4 million deaths each year, according to WHO. 1.5 million cases of hepatitis A virus infections every year worldwide. And in undeveloped countries is more common. In the US, 12,000, around 12,000 hepatitis A were reported per year. And according to CDC, incidence has stabilized at an annual average of 1,000 cases per year since 2011. This epidemiology of hepatitis B, 2.3 billion people, or 1 out of 3 people in the world, has been infected by either HBV or HCV. And 250 to 290 million persons with chronic HBV infection in the world constitute the main reservoir of hepatitis B in human beings. In the US, 850,000 people actually living with hepatitis B. And 2 people in a minute die from hepatitis B in the world. The prevalence is higher among men compared with women, according to CDC. For hepatitis C, 71 million people globally have chronic hepatitis C infection, and 2.4 million people are living with chronic hepatitis C in the US. As we see in the map, in Asia, Russia and Asia, we have the most prevalence of hepatitis C. One of the most reason for that, also for hepatitis B, is actually vertical transmission from mother to this is a progression of viral hepatitis from acute to chronic hepatitis. After entering virus to the body, we have viremia, and virus is going to liver, the major site replication. Then we have cellular immune response against the virus, And after that, we have the process of the liver damage, like necrosis of hepatocyte, inflammation, and hepatitis. And then we are going to subacute phase, bridging hepatocyte necrosis. It means subacute phase, and then fibrosis, and finally cirrhosis that shows the chronic. Here we have pathology of acute viral hepatitis. Actually, as we see in the picture, the histology of the liver. There's inflammation cell in the liver, and lymphocyte predominant lobular inflammation, and the inflammation is around the portal vein, and we say portal inflammation. Here is actually the continuous of acute and subacute process of hepatitis and end up to chronic hepatitis. And finally, we have cirrhosis that we can see in the picture, the thickened fibrous tissue of liver that shows cirrhosis. We have clinical symptoms and signs that are common in all kind of acute viral hepatitis. We have fever, fatigue, loss of appetite, nausea, vomiting. Also, we have joint pain, jaundice, and hepatomegaly. The clinical manifestation of hepatitis A, B, and C is like a courier state. Sometimes we have asymptomatic, sometimes we have acute hepatitis with fever, icter, and anorexia. And chronic hepatitis could be non-specific or persistent hepatitis or active hepatitis. We sometimes we have fulminant hepatitis and also end up to cirrhosis, and sometimes in uncommon cases we have hepatocellular carcinoma. The risk of chronicity of hepatitis B is related to age. Actually, if you have infection at birth, is associated with a clinically silent acute infection, but 90% chance of chronic infection. But in young adult, just there is 1% of possibility of chronicity. Here is the risk of chronicity of hepatitis C that is much higher than hepatitis B. And 85 to 90% after acute HCV, we have chronic hepatitis C. And also the risk of cirrhosis sometimes is between 20% to 50% within 10, 20 years. It all depends on the duration. After a long time, like 20, 30, 40 years, the risk of cirrhosis is going to be higher. Here we have the progression of acute hepatitis B, that 90% is going to be cured, completely cured, and 1% sometimes is going to be fulminant hepatitis and fatal hepatitis. But 9% of acute hepatitis B could be HBs antigen positive for more than 6 months. That sometimes is 50, more than 50% actually resolve, and sometimes asymptomatic, sometimes courier, and sometimes active chronic hepatitis. That a couple of them end up to cirrhosis. The diagnostic lab in acute phase is around the liver function test, all kind of aminotransferase increase, and aspartate transaminase, alanine transaminase, and also bilirubin could be increased. When the level is 2.5, we can see visible jaundice. And also prothrombin time could be prolonged. This is important of hepatocyte function. But the best diagnostic lab for different kind of hepatitis is antibody and antigen that we already talked about it. The treatment of acute viral hepatitis is, as we know, most cases recover spontaneously and do not require specific antiviral therapy. Uh, in hepatitis B, recovery occurs in 99%. Uh, in case of mild to moderate acute hepatitis, we do not need to use antiviral, but for case of severe acute hepatitis, we can use nucleoside analog. Actually, early treatment of hepatitis C is very important because hepatitis C is different with the other kind of hepatitis. We should treat this type of hepatitis with antivirus. Treatment of chronic hepatitis B is different if we have HBs courier or active hepatitis, or in liver biopsy we see very severe disease. We should treat with antiviral till we don't have HBs positive. But chronic hepatitis C treatment is necessary, and the goal is just disappearing the hepatitis C virus from blood. And the treatment is, as we already said, based on genotype of the virus. Vaccination of hepatitis A, as of 2006, routine hepatitis A vaccine for all children is mandatory. The best pre-exposure prophylaxis of hepatitis B is vaccine. Hepatitis B vaccine was available first in 1982. CDC actually changed the policy of vaccination in 2021. That all infants and unvaccinated children under 19 and also adults between 19 and 59 should be vaccinated. We have different type of hepatitis B vaccine. Most of them should be injected 3 times, uh, first month, second month, and 6 month. Post-exposure prophylaxis hepatitis B is hepatitis B immunoglobulin, that high risk people should receive it, including babies born to mothers of hepatitis B or somebody lives with hepatitis B, and overall high risk people. Since there is no vaccine for hepatitis C, the best prevention of hepatitis C is avoiding high risk activity like drug abuse, unprotected sex, and high risk activity. Thank you for watching the video. I hope you enjoy it. Thank you.